Happy Saturday, TikTok. So I've seen some videos lately. I thought I would address. One of them is a guy on here that follows me, great guy, and he had someone, ask a question, and then he's answering the question, and this person's getting on to him because he uses antibiotics. You have to use antibiotics in a lot of cases. That's just the way the world works. We have them for a reason. However, in this case, when you have scours, let's talk about scours and use of antibiotics. Some scour strains or bacterial or viral strains are so large that you should use an antibiotic. If you have an antibiotic that works well for scours that you are experiencing, you should use that antibiotic. But along with antibiotics, I always suggest using a probiotic. Mine specifically is calf proof. So not only can you give calf proof when you go out and tag your calves when they're newborns to give them a better immune system, you can also use it during times of treatment, or you can use it for a treatment before you go to an antibiotic. So what you would do is, instead of giving the 15-gram dose that you give when you go out and tag on a newborn animal, you're going to give them a 30-gram dose. The difference in the calf proof, and there's all kinds of different probiotics out there, is anytime, even if you're treating for a respiratory, you're given an antibiotic. A lot of my customers just give calf proof too. It doesn't matter if this is a 200-pound calf, they're going to give calf proof too, because I have a whole nother story for another day on why we do that. However, carrying on, the calf proof contains a lot more than just a probiotic or a prebiotic. It is probiotics, prebiotics, antibodies for E. coli, salmonella, corona, clostridia, crypto, cocci, 1-2 rotavirus. It's just loaded with antibodies, which help to fight infection in an all-natural way on these calves that are being treated for something else. And I love antibiotics, however, they will kill the good and the bad. So you need to reboot that system with some good flora and good antibodies to help the body respond, and also because you've lowered their immune system a little bit when you're using an antibiotic. There's a lot of clinical data to that, but you have. It's just how it works. So it also has a product in there that is going to bind the toxins that this bacteria or virus and whatever's going on in that digestive system is putting off, and help to get those out of the system. Another product that's in this is it as a tannin product that is incredibly effective against crypto and coccidiosis, but on top of that, it closes up those tight junctures, the small tight junctures of the gut, which is a whole other video again, but that really is effective in good gut health, systemic health, and treating on these calves that are have the scours or have a respiratory, and then you're getting a secondary scours most likely after you treat with antibiotics. It's just a good product with like that. There's a lot of people that give antibiotics and they don't see a response, and they give a different antibiotic. I think when it comes to antibiotics, you should always start with your what's going to work, but is not like the strongest one that you can get. Because if you start with a penicillin, for example, then okay, we got something else. Then you can go to like a Nuflor or a Baytril. Then you can, for example, then you can be like, okay, that ain't working. We're going to have to switch to a Draxxin. Then we're going to have to switch to an Exceed. You don't want to just switch up drugs all the time, but you want to start with the lowest that is going to, according to its drug class and your veterinarian recommendation, treat the symptoms which you have. If you have something else going on, or you start seeing a lot of cases, I think your best thing is to start pulling samples. Pull a fecal sample, take it to the vet, or pull a blood sample, whatever is easiest. Fecal is usually really easy if it's a digestive. like you're seeing digestive issues like scours, pull a fecal, take it to the vet, have them run that, and they can tell you what bacteria or what viral strain you have going on, and they can tell you what drug class that works against it that it's not resistant to. Because you may have something that's completely resistant to the drug class of Draxxin, but is not completely resistant to a drug class of Exceed, or a drug, something may be able to be simply fixed with some LA200. You need to know what these bacteria are resistant and not resistant to treat an animal effectively. So don't go out there just throwing, oh, this didn't work, so 2 days later we're going to throw this. What if that drug has a 3-day, extended release type of situation? What if that drug is completely not effective on whatever you're dealing with? Know your drugs. Do that and give probiotics. This video turned into a whole lot more than I anticipated. Sorry about that. Everybody have a great day.